Welcome to today's webinar, How to Think Like the NCLEX Exam Writer, your key to passing with confidence. I am the founder of Future RNPN, and over the years, I have helped hundreds of nursing students just like you simplify the NCLEX process, ditch the overwhelm, and then pass with confidence. Today, I will show you how to crack the NCLEX code and start thinking like the people who write the test so you can pass the exam on the first try. Now, does this sound like you? You feel overwhelmed by the NCLEX and don't know where to start. You are tired of memorizing content that does not seem to help you with the actual test. Or maybe you have taken the NCLEX exam before and felt like the question did not make sense. If this resonates with you, then you are in the right place. Here's what we are going to cover. One, how NCLEX writer design questions and what they are really testing you on. Two, simple strategies to predict the right answer even when you are unsure. Three, how to avoid common traps that trip up most test takers. By the end of this webinar, you will have a new perspective on the NCLEX and practice to tackle it with confidence. Plus, I'm going to share how you can work with me to take your prep to the next level. Let's start with why so many students struggle with the NCLEX. It's not because they don't know enough. In fact, many of my students know too much, and that is part of the problem. The NCLEX is not just testing your knowledge, it's testing your ability to think critically under pressure. The exam writer designed question to trick you to overthink, second guessing, and doubting yourself. This is an example right here. Now, the NCLEX make you overthink, second guess yourself, and doubt yourself. Now, we have those particular questions on the screen. So, previously tested question. The nurse is assisting with the admission of a client who is scheduled for a colon recession. Now, when a student start reading all the way from this area down to this area, now they want to know everything about colon recession. So the point of trying to know things about colon recession, they tend to think, okay, what have I learned about colon recession? What can I remember about colon recession? Now, this is where 70% of most students are going to give up and hope for the next question, right, to be what they know about because they don't know about colon recession, right? Now they give up and then they think the next question is something they should they pray and hope to know something about. Now, 30% are still going to try to figure it out. And those 70% are going to look at this question and feel like they are not going to get it correctly. Now, the brilliant students will still try to figure it out and get the correct answer. But now you are being put in a position of overthinking, second guessing yourself, and then doubting yourself. Now, the examiner is asking you which of the following statements made by the client would be most important for the nurse to clarify. Now, meaning you are thinking you need to clarify something about colon recession. Now, remember I said the exam writers design question to trick you to overthinking. Now, they want you to overthink, but what I'm trying to make you do based on this webinar is to make you think like the exam writer, for you to be able to figure out the mindset of the exam writer so you know what is really being tested instead of falling to the trick of overthinking. Now, before I go into the strategy, I'm going to introduce you to some things. Now, you need to be aware of yourself as a nurse. Now, the nurse is assisting with the admission of a client who is scheduled for colon recession. Why are you thinking about colon recession? Are you the doctor? You are not the doctor. So why are you thinking about colon recession? Can you do anything about colon recession? No. So now this colon recession is placed here as a trick for you to overthink, right? Instead, the NCLEX don't want you to see colon recession, right? Instead, the NCLEX is making you to put a blind eyes to this colon recession and think of the remaining question because that is not your scope of practice. So why do you want to think about colon recession? Can you do anything about colon recession? No. So since you cannot do anything about colon recession, the NCLEX wants you to think. The nurse is assisting with the admission of a client who is scheduled for dash because that is not within your scope of practice. You are not competent in that area. There are some things you can do, but that's not within your scope of practice. Now read the what the examiner is asking. Which of the following statements made by the claims would be most important to clarify? So what are you trying to clarify for a patient that is scheduled for? Now, what the examiner is trying to make you think is that you should think about surgery. Now, you can clarify things before they participate in a surgical procedure, which is known as your pre-op assessment. So the NCLEX is making you think about pre-op assessment, but they are putting this as a trick for you to think so much, then you fall to the trick of overthinking, second guessing yourself, and then doubting yourself because when you don't know anything about colon recession, you tend to doubt yourself. Now, let's look at these four options and see if they are related to colon recession. Now, most of the things that you will learn in pre-op assessment is that one, you want to know the location for the surgery. Now, the client made a statement. They said, I have urinary incontinence when I sneeze. Now, what location is the colon? The colon is the GI, right? Urinary is not related to the GI. So how does this relate to the surgery? It does not relate in any way. Even if you are worried about sneezing, the patient is definitely going to be under general anesthesia. So there's no possibility for the patient to sneeze when they are unconscious. Makes sense. Now, you can eliminate this out. It's important for the nurse to assess the location so that in case there's any problem with that location of that they need to do the surgery, she can be able to clarify. But right here, this is not a related location to the surgery, right? So we can easily eliminate that. Now, I had a successful cataract surgery 2 years ago. Yes, we want to know if they have had a surgery before so that now, if they are having a surgery, if there was a complication in the last surgery, we can be able to know how we can carry out the new surgery. Now, but they still have the successful surgery. So this is good. I don't need to clarify nothing right here. Now, another thing you want to notice during perioperative is the kind of medication they use because there's possibility they stop some certain medication. They don't use that, right? But one of the medication that they can use regardless is acetaminophen. They can use it. It does not have any problem to surgery, right? So since they are using that particular medication, we don't need to clarify. We don't need to clarify. One, when you have three options that you've eliminated, definitely the last one will be the correct answer. I wish you should tell my student that. So definitely this is the answer, but let's also have a good understanding about this question. I usually have a few glass of wine in the evening. It's something I need to clarify because I need to know the wine, does it include alcohol? Because we want patient to stop alcohol days, right, before the surgery, right? So I need to ask the patient, the wine you are taking, does it contain any alcohol? And now taking this in the evening, it's wrong, right? But since we don't know if it's alcoholic, we need to clarify from the patient. That is why four is the correct answer. Now, you can see with this kind of question, it's a simple approach, but the NCLEX is putting something forward for you to second guess yourself, overthink, and as well doubt yourself because the moment you don't understand anything about colon recession, you tend to doubt yourself. But the main thing main thing the NCLEX is asking is not the colon recession. Instead, they're asking you about perioperative care. You know how to handle perioperative care, but you don't know how to handle colon recession. The colon recession is for the doctor. So why think about that? So that's the reason why when you join my program, you are going to learn a lot about how the NCLEX exam writer write the question and the mindset at which they want you to know in order to answer the question correctly. Now, here are three common challenges my students face. One, feeling like all answers are correct. The NCLEX give you multiple right answers, but only one is the best fit. Now, two, getting stuck on prioritization question. For example, question that asks what to do first. Some people don't know when the NCLEX asks what to do first, what it means, right? What to do first can either be they want you to follow a certain step or they want you to follow assessment, diagnosis, prioritization, intervention, and evaluation. And what to do first does not mean you start at a certain step. It depends on the question. If the question is all about emergency, you can skip the first step to the intervention step. But if it's not all about emergency, the patient is safe, you can start from the very first step. Very important. You need to understand the themes at which the NCLEX exam write the question, right? Because there are a lot of various teams. The NCLEX write the question. So if you can master those teams, then you can be able to interpret the question better. It save you more stress, right? You understand what the question and you can give the NCLEX exam what they really want. Three, running out of time. Spending too long on one question can sabotage the entire exam. But here's the good news. You don't need to guess your way through the NCLEX. Once you understand how the exam writers think, you will start to see patterns in the question. You will be able to predict what they are looking for and choose the correct answer with confidence, right? Let's break down how the writer thinks. Every question is designed with three goals in mind. Every NCLEX writer have this three goals. One, clarity. If you cannot be able to have a certain clarity to your question, you are going to be interpreting what you should not interpret, right? The question is testing a specific competency. So why think about colon recession? You are not competent with colon recession. The medical doctor is the one competent for that um kind of procedure. So why think about it? That's not what you should think about. Instead, you should be able to open your mindset to see what the examiner is testing you and be sure that they are not really testing me about colon recession because the NCLEX don't expect me to have anything to do with colon recession. My duty as a nurse is to only assess, report any kind of complication. But this surgery is scheduled. We've not done the surgery, so we are in the perioperative stage. So meaning we are in the perioperative stage, we need to carry out some certain perioperative assessment. So that is the mind of the examiner to test you on perioperative. And when you look at the options, you saw that the options were all about perioperative assessment. Two, clinical thinking. They want to see if you can prioritize and reason through scenarios. Very important because people have a lot of students have problem with prioritization, right? Safety, patient safety is always the primary concern, most especially in your psychosocial type question, right? Or reduction of risk, right? So when you understand these goals, you can approach each question with strategy rather than stress. And this is what I want to help you overcome stress. Here's the first strategy. Always identify the focus of the question. What the writer really is asking, right? And look for key phrases like what is the priority? What should the nurse do first? What action is most appropriate? These phrases tells you exactly how to think through the answer. Now, let's try this question together. Now, a patient with diabetes report feeling shaky and lightheaded, right? Which action should you not take first? Now, when you think about it, you say, oh, I know this in nursing school. This is hypoglycemia. Reason because the patient is hypo, the patient is this is hypoglycemia. Reason because the patient have diabetes. That is what you are thinking. But when you are trying to interpret the answer based on your overthinking, you've been able to decide you need to give Three, provide the patient with a glass of orange juice. But the reality of the writers, right? The exam writers, they feel you need to carry out a certain assessment because you know this, but you don't really know what is going on. So the examiner know you will quickly jump to deciding it's hypoglycemia and do number three. But the examiner is not making you think like that. Instead, they put the question in a sense that they put you in a position of overthinking. And then when you overthink, it's a problem. I said it earlier on. It make you select the wrong answer. Now, if you tell the student three is not correct, they are surprised and they'll be like, oh, but this is hypoglycemia. What's going on? Yes, the examiner feel you know it's hypoglycemia, but where is that objective data, right? Objective data, I mean, where is that objective data that is proving? Because in also you need to prove everything. You write every information in an objective data. Where's that objective data that is proving to you or any other person that this patient is actually hypoglycemia? You can't tell me right now that a patient is hypoglycemia. I will ask, how low is the blood sugar? When I don't know that, what do I need to do? So what is the action that the nurse should take? In this question, the answer is to check the blood glucose level. True, and that's the correct answer. Now, next question. The nurse is caring for a patient who is experiencing shortness of breath. Now, a lot of students have a problem with shortness of breath. For the NCLEX, what the NCLEX know about shortness of breath is that you have three things to do. One, if the shortness of breath don't have any problem, like it's not giving any kind of problem or anything, you can start by putting the patient eye fowler. But if the shortness of breath is accomplished by a critically low oxygen level or increased respiratory rate, we give oxygen straight, right? Now, your shortness of breath is a statement, but the nurse as well to need to like find out what is causing the shortness of breath, most especially questions that comes with no reason why the patient is having shortness of breath, such as this. Now, when you think about questions like this, your first action should not be, oh, somebody's having shortness of breath, right? Now, I told you, let's write question and make every answer look correct. Administering albuterol can help shortness of breath. Oxygen can help. Eye fowler can help. But what is your first action for somebody that you don't have an idea why they're having shortness of breath? The shortness of breath is not even linked to any condition right here. What you do is four, and most especially the shortness of breath don't have any objective data to prove the shortness of breath. So four is what we are going to do. Four, place the patient in a eye fowler position. The third strategy is eliminating distractor. NCLEX writer include answers that sound correct but don't fit the situation. Let's try one more. Now, a patient recovering from surgery reports pain at the incision site and rate it as 8 over 10. Which action should the nurse take first? In nursing school, we learn when the patient is having severe pain, what we want to do is to administer pain medication. We trust the when the patient tell you they have pain, we don't judge, ask them unnecessary question, we give them their pain medication. That's what we learn in nursing school. But the mindset of the examiner, right, the exam writer, right, is to test if you can see if there's any reason why the patient is having that pain first before you decide to give the pain medication. Now, we might be thinking, okay, we can reposition. You don't reposition when the patient reports pain, anything above 7, because that is severe. You should understand mild, moderate, severe. So severe pain is due for medication, not repositioning. So you can take that out. You don't need to start thinking, oh, maybe they are sleeping on the surgical site. Maybe there is an issue. No. Medication, yes, we want to give medication, but the mindset of the examiner, most time, you need to understand. The question says the patient did not only report pain, instead, they report pain at the incision site. There are more things we need to reason based on that incision site. So, why do you think it's appropriate to go directly and give pain? What of if they have infection, bleeding? So, the best right is to carry out assessment, assess the patient incision site for sign of complication. Now, one thing the NCLEX always used to do is that most time, because they might feel you have double thinking, right, overthinking, they make sure that there's something directly linked to the question. This is the incision site. Incision site. Now, the same examiner that gave you the question that told you pain at the incision site, he tell you to access the patient incision site for sign of complication. They know what they are doing. They know a lot of students will want to give pain medication because they know it's a severe pain, right? But the NCLEX is saying, giving you an hint that why don't you access the incision site to see sign of complication, right? Very important. These are things you are definitely going to learn when you join my program, right? And you would be able to answer questions easily. Let's talk about how this strategy transform your approach to the NCLEX. Before mastering these techniques, many students feel stuck, overwhelmed, and unsure after applying them, right? After applying them, my students feel confident and in control. Take one of my students as an example. She failed her first attempt at the NCLEX, right? And was ready to give up. After working with me, she passed on her second try and said, for the first time, I actually felt like I understood the question. That is the power of thinking like the exam writer. If you are ready to take this strategy further, I would love to invite you to join my course, How to Think Like the NCLEX Exam Writer. Just for $159, you will get step-by-step strategy to tackle every NCLEX question, practice question with detailed explanation, bonus question and answer session where I personally answer your question. So, to enroll, simply message me on Instagram future RN PN, and I will guide you through the next step. Remember, the NCLEX is not about being perfect, it's about knowing how to think through each question. So, if you are ready to make that mindset shift and finally pass your exam, message me on Instagram, future PN. I can't wait to help you achieve your dream of becoming a nurse. Thank you so much for joining me today. I hope you found this webinar valuable and that you are feeling more confident about tackling the NCLEX. And don't forget, when you are ready to take the next step, message me on Instagram, future_RN_PN. Together, we will make sure you pass the NCLEX and start your nursing career with confidence.